Good morning and good afternoon and welcome back, everyone. For those that have not had the opportunity to meet, my name is Christiane Sadeler, and it's truly been my pleasure to be your MC for this Lean In National Conference 2022 of the Canadian Municipal Network on Crime Prevention. You know, dialogue about complex issues is really central to community safety, and I think that's what we've done here over the last few days. Yesterday, I stumbled across a quote by Bertrand Russell, and it read this: "People's opinions are mainly designed to make them feel comfortable. The truth for most people is a secondary consideration." I firmly believe that gatherings of this nature inevitably create some discomfort, and I also believe that in that discomfort lie the seeds for change. The network itself, in a way, is testament to that belief of mine. It started with the uncomfortable realization that when it comes to public safety, the power of community and the voices of municipalities had been all but ignored for way too long. That planted a seed, and here we are today. And as we're getting towards the end of our time together, we get to lean in one more time when we have our final keynote panel on emerging trends in the context of community safety and the official closing of the ceremony. But first, it's my pleasure to re-invite Jan Fox, the co-chair of the Board of Directors of the Canadian Municipal Network on Crime Prevention, back to the virtual stage to say a few words. Jan?
Thank you so much, Christiane. It's an absolute pleasure to welcome you all to the final part of the conference. It's certainly been a busy 3 days, and I hope you all enjoyed the thematic and coaching sessions as much as I did. I'm just going to start out, Christiane, today to briefly go over today's agenda as we move to a close of a very incredible conference. During the keynote address, you will hear about emerging trends and work related to crime prevention and community safety and well-being. Today's panelists are an incredibly diverse group of presenters, including Santiago Uribe, who is the Chief Resilience Officer for the city of Medellin in Colombia. We also have Chief Superintendent Peter Tewfik, who heads up the brand new Alberta RCMP Community Safety and Wellbeing branch, and Karen Campbell, the Director of Community Initiatives and Policy at the Canadian Women's Foundation. Following the keynote panel, we will wrap up this year's conference with some final words by Colleen Cornack, who was on the conference planning committee, and some final words also from Mayor Sandra Masters from the city of Regina. I now have the pleasure to welcome Dr. Benjamin Roebuck, the new federal ombudsperson for victims of crime. Dr. Roebuck holds a PhD in criminology from the University of Ottawa and is an internationally recognized expert in the field of victimology, with over 15 years of experience as a researcher and educator on victim rights. Prior to his appointment as the federal ombudsperson for victims of crime, he was the research chair and professor of victimology and public safety at Algonquin College, where he was a founding member of the Victimology Research Center. We're very fortunate to have you here with us today, Ben, and welcome.
Thank you so much, Jan, and thank you to everyone who is tuning in from all across the country and other places. It's my great pleasure to join the conference today. I'm so impressed with the work that the Canadian Municipal Network for Crime Prevention has been able to do in bringing people together, mobilizing resources for crime prevention, and in creating spaces to learn and exchange knowledge. So this is exciting. So I'm 3 weeks in, friends, to my job as the federal ombudsperson. So I am learning a lot. And I just want to share a bit about our office and how I see it connecting to the work that's happening at the conference today. Our office works in the federal government with listening to survivors of violent crime or other victims of crime who feel like they haven't received the rights that they're entitled to under the Canadian Victims' Bill of Rights. And so we have an intake team that can listen and log complaints, and then they'll actively work on trying to resolve issues for the people that contact us. And then we monitor all of those things and interact with federal government policy to try and take the issues that we hear directly from survivors and bring them forward into the legislative policymaking process. And so I see quite a connection with crime prevention, because we all share the same goal of creating safer communities for people to live, reducing violent crime, and living in safe and inclusive spaces. So I want to acknowledge that my connection to this topic started a number of years ago when I was a PhD student at the University of Ottawa. And I was involved in the Institute for Prevention of Crime, where the municipal network was just starting to form. And I thought, my goodness, what a powerful opportunity for these cities to work together and accomplish something significant in Canada. And I want to thank a few specific people who I know are quite involved in the network and that you're probably very familiar with. One, Dr. Irvin Waller, who taught me about the value of evidence-based crime prevention and the need to measure and monitor what's happening on the ground so that we have a base of evidence that can be used effectively to convince policymakers to take action and invest more proactively in prevention. I think Irvin, if you don't know Irvin, he tries to enable everyone everywhere to take action for prevention and reducing victimization, and his passion is inspiring, and so is his t-shirt on the UN Development Goals. Christiane Sadeler, thank you for opening this session. From Christiane, I learned in those early days about the importance of community-based perspectives, and that an evidence-based program in one context might not be the exact fit for a community that's different, and the importance of listening to people in the community and learning from them, and building those perspectives and local leadership into programming. And so I'm thankful for that lesson. From Nancy Worsfold at Crime Prevention Ottawa. I was on her board of directors for 4 years, and what a force to be reckoned with. I know she's just retired, but she taught me a bit about the necessary political savvy and leadership, and sometimes gamesmanship involved in the political sphere at the municipal level, and how to effectively connect with people and make sure that your stakeholders are engaged, and to create spaces for lots of different voices to come to the table so that there's collective ownership over what's happening. And the last area I want to acknowledge is for myself personally as a researcher, at the time researching on youth homelessness, it led me to start to ask new questions about whose public safety are we interested in? And is it fairly distributed across society that that we're not only interested in crime prevention for people with privilege or leaders in the business community, but also for people who are homeless, who experience tremendously high levels of victimization. What does prevention look like there? What does victim assistance look like for people who are homeless, who've had their things stolen, who might have been physically or sexually assaulted, who don't feel safe in congregate emergency housing? And so what role might housing and access to housing play in prevention? I think I've seen firsthand that without safe and affordable housing, so much happens that we could prevent simply by having better access to housing. So the Canadian Municipal Network is focused very much on preventing and reducing victimization. And I see our office as preventing secondary victimization and in the criminal justice system, and contributing to tertiary victimization. We want to ensure that all victims of crime who have a federally sentenced offender who's sentenced for more than 2 years have access to conversations about their safety, that they're consulted actively by the parole board or by other authorities on what they feel will make them safe, that information is taken into consideration to prevent further acts of violence and to make sure that their voices are heard. And so when people aren't consulted, they can contact our office and we try to help resolve those issues because it's so important that people are heard. I'm almost done, friends. We also have this challenge or barrier in the current federal legislation where information for victims of crime is available upon request. But a lot of people don't know what they can request or where to ask for it and how important some of that information might be. For example, if you haven't registered with the Correctional Service of Canada as a victim in their portal, then you won't be contacted about a parole hearing or how to submit your victim impact statement, or what safety considerations might need to be considered. And Canadians don't know that. And so we're working actively to increase awareness of that mandate so that we can contribute to better community safety and preventing tertiary victimization that might happen with released offenders. I think all of this work gets tied together, that we prevent crime effectively with support and trauma-informed, evidence-based community responses that are proactive and upstream, and also that respond effectively to victimizations, so that we can interrupt cycles of violence. This is my side note, my little side note quickly. I'm so pleased to see a national action plan on gender-based violence coming out of the federal government. And we need so much more work to effectively respond to violence against women, and enough shelters, because women are being turned away and it's not safe, and we need better options. We also need to pay attention to the experiences of men and boys who are being victimized, whether it's missing and murdered Indigenous men and boys, of who there's so many, and so many families that are grieving, or whether it's racialized minorities who are disproportionately affected by gun violence or other types of victimization. These types of questions have to come up as we look at whose community safety are we considering. So finally, I'd like to thank everyone involved in this conference, everyone in the network, everyone who's tuning in today, for the incredible work that you do. I know it's hard work. Years ago, my wife and I moved to the UK for a brief period, and I got to sit in on a UK community safety panel. And I was so excited because I'd heard from Irvin about the innovative work that was happening. And I sat through probably about 30 minutes of community discussion on uneven sidewalks. And I know some of you have been in those same chats. And it's important. Obviously, we don't want people tripping and falling. But I know that listening takes work, and it takes patience. And when we can listen with compassion, and we can listen with respect, and when we consider diverse and different voices, we can work together to improve things and create safer spaces for all of us to live and to grow. So from the Office for the Office of the Federal Ombudsperson for Victims of Crime, I want to thank you for bearing with me as I chat. We're here to listen and to learn and to support victims of crime, and to bring forward issues that we're hearing from victims of crime into the federal policy sphere. And if you'd like to contact us, you can reach us at www.victimsfirst.gc.ca. And if you have your phone and you're on Twitter, you can open it right now, and you can follow our Twitter handle, which in English is @OFOVC. So thank you. I wish you great success, not just in the remainder of the conference, but in all the work that happens afterwards as we consider what we've heard and put it into practice. All the best. Thank you.
Wow, thank you so much, Ben, and lovely to see you. And you sound like you've been in the job for many, many years, rather than just 3 weeks. I'm really impressed sort of with the connections that you are making between your office and also the areas of crime prevention and community safety, which you rightly point out is way more, is about so much more than uneven sidewalks. I also want to sort of just say, you're very gracious in acknowledging that you're standing on some shoulders of other people. Thank you for including mine. We all stand on the shoulders of other people, and that's really what it's about. I think the change that we're trying to affect is intergenerational. I often think of it as planting a seed for a tree that I will never sort of get to sit in its shadow, but I hopefully get to sort of see it grow for a little bit. And I really sort of appreciate your humility in acknowledging that. Many years ago, one of your predecessors said to me that incarceration is not a victim service, and that always sort of is something that stuck out in my mind. I believe that at the end of the day, crime prevention is the best victim service we can provide. Meanwhile, since we haven't affected that yet, the work of your office is so critical to keep the voices of victims front and center to the work that we all do. And I really appreciate you asking us, whose safety are we talking about, and including in the lineup of people that we ought to consider Indigenous men. which are less frequently talked about. Racialized groups, people from LGBTQ plus community, and so on and so forth. It really is a critical question, and we can't be safe in our community until all of us are safe, including those groups. So thank you so much for that reminder. What a terrific start to our keynote panel. We wish you all the very best, and we hope that you stay in touch and your office stays connected to the national network. I think together there's many things that we can do to improve safety in our communities. So thanks so much, Ben. Lovely to see you and have you here. It's now my great pleasure to welcome the presenters of the final keynote panel to the virtual stage, and we will be exploring emerging trends in the prevention of crime and violence and community safety and well-being. Jen already shared with you a little bit about their background, and I will share a little bit more in just a moment. Each panelist will present for about 20 minutes. That should leave approximately 30 minutes for what's so important in these gatherings and so much harder to do on the virtual stage, and that is some discussion, questions, and dialogue. If you have questions or comments, similarly to the opening day, please type them in the chat function, and I will share them with the presenters during the question and answer period. Each presenter will follow the other. We're not going to pause after each presenter, so take notes as I am, and please use the chat function for your question. Perception and reality of violence is increasingly becoming a challenge across Canada. Some communities are experiencing a drastic rise in violence, sometimes even higher than they've ever experienced before. The good news is that these upward trends can be reversed. Medellin, Colombia was once considered the murder capital of Canada. By investing in effective crime prevention approaches, Medellin was able to drastically reduce its homicide and violence rate. Despite the differences between the Canadian and Colombian communities, there are a number of lessons we can take away from the efforts in Medellin, particularly that with dedication and investment in evidence-based approaches, a drastic reduction in violence is in fact possible. For 6 years, Santiago Uribe Rocha was the Chief Resiliency Officer for the city of Medellin. And I must admit, I love your job title, Santiago, Resiliency Officer. What a terrific title to have and a job to have. Prior to this, he worked as the Executive Director of the Social Innovation at Pygmalion for 3 years. There, he coordinated several research programs on topics ranging from disaster risk management and violence prevention to local youth, reproductive, and mental health. From 2007 to 2010, Santiago was the administrative assistant of cultural and economic affairs at the Embassy of Colombia in South Africa, where he coordinated official visits to exchange experiences and expertise for the implementation of a peace process in Colombia. Santiago, we're so pleased that you were willing to join us here. Thank you so much for being here, and we look forward to what you have to tell us. The stage is yours.
Thank you, Christiane, and thank you, everybody, to be with us today and the past 3 days, I believe. I would like to be part of the whole event, but I'm right now in South Africa, actually continuing this learning process of sharing experiences about violence prevention. And if you all see the first slide, the name is provocation, and it's called Medellin, a living lab. And it's called a living lab because it truly reflects what we are. We are a city in the making. We haven't been able to fully succeed, and we still have so many great challenges when it comes to violence prevention, crimes reduction, but most importantly, to social inclusion. I'm not gonna stop here. As Christiane was saying, I was so privileged to be one of the first chief resilience officers appointed in the world. We, as a city, we are city member of the 100 Resilient City Network. And basically, this network is focused on actually trying to understand how we can learn from each other's experiences as urban systems. So we share some lessons learned and experiences with many cities like New York, London, but also smaller cities like Panama City, Porto Alegre, but also with Canadian cities like Montreal, I think Toronto and Vancouver, because I had the great privilege to meet some of your chief resilience officers there in Canada. And bear with me a few seconds, because it was an interesting moment of realization when, after the first wave of applications, out of 378 cities, only one applied understanding resilience from a social perspective. And I kept, because this is a copy of the fragment from our original application to the Rockefeller Foundation, where we as a city state that resilience means nothing else but the capacity of our city, our urban system, our political, social institutions, and the ability of our inhabitants to resist, overcome, and still learning from the causes and effects of urban violence, but also from the internal conflict that we've been suffering in the past 6 decades. And when I was appointed Chief Resilience Officer, I went back home. It was on the news, and I was telling my mom, and she couldn't actually pronounce the word resiliency. And I knew how great my challenge was at the time. So I tried to look for a simple expression to explain my mom what resilient means. And I found out this amazing quote from Ernest Hemingway that it says, "The world breaks everyone, but afterward, many are strong at broken places." And I want you to keep that first message. I think we should really acknowledge that, especially in urban systems, cities, many of those urban cities are broken places. Many of them are failing fundamental promises. And that's why I always start these type of conversations with a question mark about what does a city mean actually. And normally when we try to answer those questions, we use resources like maps, and that's the map of Medellin, or we use iconic infrastructures to identify our cities, and we use buildings like this. And I'm sure you recognize all of them there. Or we use pictures, beautiful pictures like this. That's Medellin. But normally we forget to acknowledge, and in the case of Latin American, African, and some Asian cities, these are also our cities. These are images of our cities, or like this one. And I used to call this is a tale of two cities, or not even two, but too many cities that coexist in the same urban system. But one of our first and the most amazing findings when we were dealing with such a complex time of being the most dangerous city of the world historically, and that funding was, cities are not infrastructure, cities are not buildings, cities are not traffic lights, cities are people. That's the most essential cell and a fundamental structure of cities, people and their families and their communities. But because I'm an anthropologist by training, I also ask myself, but why we wanted to live in this so complicated systems where we gather, where so many of us come together and we gather. But we were in the search of three fundamental principles: protection, and we confuse that very often today in modern times with security or safety. We were in the search of exchanges, and those first exchanges took place in markets. And we were in the search of opportunities, education, culture, recreation, and many, many, many more opportunities. And again, is this question mark about what happened in the city that 30 years ago, in 1991, but from early 70s, it was already becoming the most dangerous city of the world. And for you to just get an idea, in one single year, 6,500 kids and youngsters from 9 to 21, 22 were killed in our city. And in the long period between 1985 and 2005, and around of 20 years, close to more than 100,000 people were killed in my city. For you to understand the magnitude, 20 murders per day were committed in Medellin at the time. But what happened in a city, in that same city, that 3 decades down the line, that number has come down to 10%, not even 10, 5%. And what is more amazing is that we no any longer part of the top 50 more dangerous cities. But I want to highlight another message here. Any life that we lose violently is a great loss. And a philosopher from our city used to say, Dr. Beatriz Restrepo used to say, why every single life is a great loss when we lose it on violent and crime. And she used to say, because it's a promise. We cannot really know what could happen if that person had the opportunity to fulfill his or her dreams, but it was also a human heritage. The humanity has put so much energy in that person, and we lose all that energy and all that history when we lose a life. And for you to start to understand how complicated it was for us in terms of putting every single effort in understanding what we call the ecosystem of crime and violence, but we should call it today the ecosystem of safety, security, and social cohesion. We tried everything, and we tried everything with few principles. But one of those most important principles, Dr. Benjamin was already identifying and explaining to you, is all the evidence base possible in understanding that ecosystem. And what you have there is 3 decades of how that homicide rate has change in the city. And on the green line, you have the names of every single mayor of our city at the time. And if you click at those names, we actually are able to see the public policies that every single mayor was implementing in his term. Sadly, if you look at it, they are only males. 30 years of power with only males. And that should tell us an important finding. We think now that if a female probably had the chance to become the mayor of our city, we probably started this prevention work more efficiently long ago. And on the blue and purple line, you have the names of every single individual and or organized crime sort of institution or gang that affected the city at the time. And that is important because they also have public policies. They also organize and they target certain goals and objectives. So this is the same statistics aligned with some of the public policies, but just to acknowledge something, Medellin was not just the most dangerous city of Colombia by itself, but during 6 months, from August 1989 to April 1990, 3 candidates running to become presidents were killed. That's how bad our nation and our city, or that's how bad the situation we face during the time. But the woman on the right was appointed a minister as a minister from national government for peace for Medellin. And Maria Emma came, and meanwhile you watch some of the pictures of and find out of how one of our greatest artists portrays violence in our city. When Maria Emma was appointed the Minister for Peace for our city, she was actually the first person who came to have sort of a coordination job between national government and municipal government in terms of violence prevention and peace building. And she came to Medellin. She was young, and we all believe that because she was a woman, the city benefit a lot from the way women think about violence and especially about prevention. And she actually came and acknowledged something: national government didn't have the power to help us, and they didn't have the resources, human and economic resources, to help us. So we all recognize that there was only one way to get out of this, and it was we should all work together to come out of such a complex crisis. And as a chief resilience officer, my job has been trying to understand what happened in Medellin, what was done, what are the strategies, the actions implemented that help us to transform the city. And I have put those actions into 3 main components. And I said we started from the end. And starting from the end was that Maria Emma came to our city and set up another amazing tool as a methodology, which was a civil society participation planning process. As Dr. Benjamin was telling us, listening was the fundamental tool to start introducing a transformation in our city. And it was so well structured that for 4 years, Maria Emma and a team went around the city talking with people about what do we have to do to transform a city, and following one principle. We may not get, we may not agree on the past, but what if we concentrate all our energy in agreeing on the common city we wanted to build together? And when people were asked about if we want to bring safety and security here, what do we have to talk about? And people said we need to talk about housing, employment, education, culture, mobility, security, safety. And for 4 years, they were going around to every single neighborhood and having these round tables that were called round tables on alternative futures for Medellin. And after 4 years, we had put together what is well known as a strategic master plan, Medellin and its metropolitan area, 1995-2015. But when you plan something and you finally get it in a document, there the second principle comes. Don't wait for the perfect circumstances to unroll so you implement your plan. What you expecting, it will never happen, the perfect conditions. So go immediately, and this principle that someday is today is start implementing as many strategies that you can actually do. And these are images of how, for example, informal trading was taking place, how we designed an urban renovation to regenerate with safety and security principles this public space, and that's how ended up being implemented. And that's what we call a social and urban transformation. The city decided that to reduce crime and violence, security measures were not enough, and we had to integrate a more sophisticated strategy of social and urban transformations. And by doing that with limited resources, we applied another simple concept. What if we do that in places where the human development indicators are the lowest and the indicators of violence are high, and we deploy all our resources and forces to trying to transform those communities and territory. And that's what we call urban acupuncture. And we went there and we actually implemented as many urban strategies like childhood care centers, schools, an integrated transport system, and one of the most sophisticated transport systems with metro, trams, you have museums and cultural centers, and an innovation hub, sport districts. But at the same time, we understood that you cannot transform a past so deep in violence within one term or two terms, and you needed much more time than that. And the evidence, as I was telling you, help us to actually understand the complexity of what we were dealing with in terms of quality of life, in terms of unemployment, in terms of income per capita, in terms of youth high education, and also the hotspot of crime and violence maps. And after certain point, the city actually understood that the urban and social transformation was good enough, but we needed much more than that. And when I say much more than that, we actually put all our energy, after trying so many strategies, to put together now what we call public policies. And our resources, human resources, and all our efforts were targeting three main goals: peace and crime prevention, prosperity, and what we call proximity, bringing public services close to the people. And this is not just an spatial concept, but it's a social concept. And these are the three most important public policies that were implemented and were designed in our city. And why at the center is actually not the safety, security, and social cohesion public policy when we're talking about crime and crime prevention, crime and violence prevention, is because we understood a fundamental principle, especially in our cities. We don't know how to live in cities, and we need to learn how to live in them. And we ended up working for about 3 decades on putting together what we call the citizenship culture and programs, and a citizenship culture secretary teaching us how to become good citizens, but most importantly, how to become good neighbors. And on the other hand, we also spend a lot of energy on putting together a public policy on safety, security, and social cohesion. And you have seen already that was a strong effort on transforming the urban form through social integration in our city. And the final element is in Spanish, and is reconocer. And reconocer, you read it both ways, is to acknowledge your challenges, that you have great challenges, that you cannot do things just with infrastructure, but you need the power of civil society, of people organized, deploying as many programs and as many efforts possible to help you reduce crime and violence. So we have schools of theater, dancing, music, all of them together, helping us to reduce crime and violence and to do preventive work. And that's what we call hard and software. And these are images of one of the most violent districts of Medellin during the 90s, and how they became hubs of culture and life, education, and recreation. So we started talking about how our city is a living lab of innovation, and it's nothing else of a city that has tried to be inclusive, resilient, and safe. And before, because I mean, over time, almost 1 or 2 minutes, I just want to tell you an amazing story to this. When we started this process, it was a professor from the public health department, probably one of the first in the world, that actually helped us to understand that whatever you don't do in terms of crime prevention becomes a public health issue. He was actually the first person who said violence is a public health issue. And he started a job from the public health department, and they set it up the first round table of resilience of the city of Medellin in 1988. And guess what? It was with the help of the Canadian people. And we had the first project talking about resilience called Pathways to Resilience. We knew the path. We knew the path with your help, that the only way to get out of such a critical moment was through empowering people and letting them become more resilient individuals and more resilient communities. Thank you so much.
Wow, Santiago, thank you so much. I took so many notes. I learned so much from you just in this short time. I wish we had much longer. The story of Meridian, and I understand I pronounced it wrong previously. is really quite amazing. The numbers that you share are staggering, and certainly not something that we're used to in the Canadian context. But what struck me as you spoke about the roundtables, I think if we put people anywhere in Canada together and say, what are some of your challenges and what are some of your solutions, they speak of the same things. They speak of housing and employment and proximity to government and needing to be heard and the importance of helping us to sort of coexist peacefully, being something that we need to learn, that it doesn't come automatic to us, and we need to sort of bring opportunities to people to experience that and test it out. I think all of those things would be very much true in communities the world over. I sort of admire the courage of the people in Medellin to acknowledge that the change may not come from the top down. It may have to come neighborhood by neighborhood, and that you have done that amazingly. The other thing that really sort of stuck out for me, and I've not heard this in previous presentations in this area, and I've heard many throughout my life, is that you sort of highlighted, we might think of victims of crime just as a number, over 6,000 back in 1991, I believe you said. But with every life lost, something is lost to our community. And what an important reminder to us all, and what sort of added motivation for us to do the work that we're doing. So thank you again, Santiago. I'm sure there'll be all kinds of comments and questions once we get to that part of our agenda today. And it's now my pleasure to welcome Peter Tewfik to the stage. Over the past couple of years, community safety and community well-being have become key aspects of crime prevention work in Canada as part of addressing existing and growing public safety concerns. Recently, the Alberta RCMP has incorporated a community safety and well-being branch into their work, and Peter Tewfik is the officer in charge of that branch for the Alberta RCMP. I understand he's passionate about collaborating with community leaders, and I always love to hear that, and police professionals across the province to identify issues contributing to community harm and developing strategies to design to reduce the multiple contributors to crime and victimization over the long term. Before starting in his current role, Peter was the officer in charge of the crime reduction strategy for the Alberta RCMP, and he was awarded the Order of Merit of Police Forces for leadership and exceptional service over an extended period. He was also the recipient of the Meritorious Service Medal from British Columbia, as well as the Commissioner's Commendation for his contribution in developing new investigative technique, which has been adopted by the RCMP and shared internationally. We've asked him to discuss with us the role police can play in advancing community safety and well-being, especially by highlighting the work the branch is planning to do and how it will partner with communities to increase community safety at the local level. Peter, thank you so much for being here. Certainly a long track record of engaging with this issue, and very excited to hear from you about the community safety and well-being work with the RCMP. Stage is yours, Peter. Thank you.
Thank you so much. And I just really appreciate the opportunity to get to address the group here and share some of the work that we're doing here in Alberta. I'd be remiss, I guess, like some of the other speakers, not to acknowledge, this is based on work that obviously came before us and building on, practices that we've had the opportunity to learn in other areas and other jurisdictions. And we continue to, seek new ways of doing business. So I'm going to talk a little bit about community safety and well-being, a branch, and, it's a new branch for the RCMP. And certainly, the first of its kind for the RCMP in delivering the kinds of services we are here in Alberta. Really, it was born of concerns that we have heard from our communities. I'm going to talk a little bit about engagement. And really, if I think about the starting point, it's challenged with the question to talk about, why did we develop this branch? Why did we want to take this approach? Really, policing across the country and in fact, across North America has been challenged. We've been challenged because I think communities' expectations are changing around what they want their police service to do. I think our understanding of some of the contributors to, to crime and victimization are changing. And, if I go back to the very first principles from Sir Robert Peel, policing is about a partnership between us and the community. And so I really think this branch is designed to kind of reinvigorate some of that partnership and, have police as partners at the table for some of the really complex solutions that I think, we need to start to look at if we're going to start to tackle some of these problems. I really wanted to start by talking about, some of the challenges I think that we have. Defund the police. I think there's a recognition that law enforcement's not the appropriate tool when it comes to dealing with challenges of social disorder and mental health crisis, addictions, and unhoused people. Police are not the right tool for dealing with the social causes that contribute to those things. Perceived militarization of policing. Calls for shifts, in policing from being warriors to being guardians with a real focus on procedural justice. Institutional racism. Throughout history today, there's people in communities who face systemic racism and discrimination in our country. We have calls from our Indigenous and Métis communities asking for, nothing with us, nothing about us without us. An approach focused on inclusivity and policing with our communities. And I talked at the opening about how important I think that partnership is between police and the communities we serve. And it is very much about policing with our communities. That engagement right from the local level, right through, to the national level in terms of, what the expectations are of the public. It's something I guess the RCMP is sort of uniquely positioned as Canada's national police force to be engaged at all of those levels throughout the system and start to think through, how can we do a better job of that? So the branch was sort of born at looking at these challenges and thinking about, what's our path forward? And really, I think it's partnership, engagement, and collaboration. So we talked about, these are complex problems we're tackling. It takes a multidisciplinary approach if we're going to get to, some solutions that are going to really reduce the impact of crime in the communities that we serve. So I'll take a little bit of time and talk about our vision. I kind of mentioned those three kind of pillars of partnerships, engagement, and collaboration. So, we've had really good partnerships over the years, and we know we have to continue those, and we have to improve them, and we have to expand them so that we can have new networks. So, we know that building partnerships help us break the cycle of crime and victimization. We know that it helps improve social well-being. So today I'm going to talk a little bit about our regional police and crisis teams, where we partner police officers with mental health professionals to respond to people in mental health crisis. I'm going to talk about our integrated offender management, which is really about a holistic, multidisciplinary approach in dealing with those offenders that are creating the most harm in our communities by engaging our addiction specialists and social services and housing and income support that actually really have a huge impact on reducing those offenders continuing to commit crime. I'm going to talk about the virtual opioid dependency program, which is, when we take people into our custody that are opioid dependent, we have an opportunity, and we've partnered with Alberta Health Services to, give them access to a medical doctor and same-day prescription start that will provide them protection against overdose and reduce their cravings for the drug. When I talk about engagement, and I did mention, we've listened to our communities here in Alberta. We've heard, from attending town hall. I've heard from attending town halls right across the province, that Albertans want more engagement from their police service. We've developed in our branch a community engagement and outreach component of our service delivery model. We have a diverse community engagement unit that's focused on engaging with our diverse communities right across the province, listening to their issues, and more importantly, how we can adjust our police service to better meet their needs. And our commanding officer has an advisory committee made up of people from those diverse communities, providing input on the policies and strategies that we have so that we can be thoughtful around, how the decisions we make are going to impact those communities. Same with our Indigenous policing services. So again, across the province, we police a number of Indigenous communities, and it's about, engaging with them on what that service delivery looks like and meeting the priorities that they have within their nation, and how do we fit in serving those priorities. And our commanding officer, again, has an Indigenous advisory committee that advises us on, what are the things we can do with reconciliation? What are the actions we can take to move forward in some of those? We have a community engagement tracker. So this is a big priority for our commanding officer here in Alberta. It's an expectation of all the commanders that we have, and it's something so important that we track in order to make sure that we are meaningfully engaging at all levels, the citizens we serve, the elected officials, and understanding the needs of the communities that we are policing in. And lastly, I'll say our callback unit. So, we have members that for a variety of reasons aren't able to be out on the front lines policing, and we use those members in our callback units as a unique way to engage with people that have reported crime or have information they want to supply, so they can actually speak to a police officer, but maybe a police officer isn't required to attend their residence. And if in fact they are, as a result of that call for service, that unit's positioned to be able to send that out to the local detachment and ensure that part of the engagement happens. But it allows us to reduce some of those barriers, concerns people have about reporting information, and actually make sure that we're engaging appropriately with them. And then lastly, like in collaboration, we are committed to collaborating and looking at evidence-based approaches that are going to reduce harm in our community and improve community outcomes. And we have a couple of projects. So one of them, which I'll talk about today, started as an enforcement table around, what can we do in terms of where our biggest problems, a problem-oriented policing approach to addressing what those issues are. But, I'll say over the evolution of that model, we recognize that what we need really is a community part to that we can engage with, and that can actually give us a better picture of the landscape and actually provide even some of the solutions that we need, as we look at solving some of those issues we have from a law enforcement perspective. So I'll start just, an overview of the branch. One part of the branch is focused on, public safety. So those are our offenders, the things that are contributing to crime, identifying those people creating kind of the most harm in our communities, the factors that contribute, the vulnerabilities that contribute to that crime going on. And then on the other side is the community well-being side, which is really about that engagement, proactive work, partnerships with other agencies at trying to get at what those root causes of either the criminal activity or maybe contributing to some upstream programming that might reduce people entering into the justice system or coming into contact, becoming justice involved. So really that's the two pillars. At the center is our analytics and intelligence. So, we've really put a focus in the last number of years on how to leverage the information and intelligence we have and make it really readily understandable for all of our members, our frontline members. And we use that to guide our operations really on both sides of the work that we're doing in the community safety and well-being branch. These are just, some of the units that now kind of align under that from both the public safety standpoint as well as from the community well-being standpoint. It's really looking at crime reduction, outreach, analytics and intelligence, and engagement with our communities across the province. So, I believe, and I think, this is kind of well understood in policing, there's not just one approach. For us, it's about education, prevention, intervention, and enforcement all coming together as an integrated approach to really have that impact on community safety. We don't apologize for enforcement. It's part of, what we have to do, but we recognize that enforcement can't be the only tool in the toolbox when it comes to reducing harm in communities. We have to work through all of these things, but not just ourselves as police, but actually in cooperation with communities and the other agencies that are working so we can have, an effective response to the impact of crime. And really, I'm talking about collective impact, right? It's about how do we all work together in a cohesive way, use the strengths from, each of the different groups. And, for us, it's about being partners at the table to provide what we can in terms of information, insight, and allowing us to work with other agencies so that we can actually start to make an impact in the communities that we're serving. So I'll say, and I think it's been mentioned already, there are these factors of, economics, healthcare, the context of social and community, the neighborhood, the environment, education, all play, as social determinants of health. And that if these things are not healthy, that there'll be poor health outcomes. And, what I can tell you is those same factors also become social determinants of justice. So what we've seen is in areas where those factors that contribute to poor health outcomes also contribute to behaviors that lead to people becoming justice involved. And so, if we can start to address those, then we know that we can have an impact on, reducing crime and victimization in our communities. And really, a lot of what I'm going to talk about as I move forward is, being, conscious of the impacts that those things have in our communities, and, maybe the role that police can play as a partner at the table in providing, information and insight, or maybe even a pathway for some people to be able to improve some of those outcomes. So, I talked about the stream, and if I can stick with that for just a minute, the downstream effects that we see is where, police, ambulance, emergency health services, emergency social services are dealing with people that are in crisis. And those are the outcomes. But we know that, those outcomes are driven by those social determinants that I'm talking about. So it's those other factors that are leading to the outcomes that lead to police intervening at that moment of crisis. Maybe something terrible has occurred, and the police are responding to that occurrence. But if we can start to address some of those factors that create those outcomes, we know that it's going to have a positive impact on crime. So I just want to highlight a few of the things that we're doing. Obviously, it's only 20 minutes, so I can't go through a lot. It's pretty high level, but just kind of highlight some of the things that we're talking about. To start moving that upstream, either from an intervention and even from a prevention standpoint. So we did a review of our police files, and we identified that some of the same factors that drive offenders to commit crime contribute to vulnerabilities in victims of crime. And I don't think this will come as a surprise to anyone. But those factors are housing insecurity, income insecurity, substance abuse, mental health issues. So we know that those factors exist, and we have 20% of our offenders create 80% of the harm in Alberta. We have 10% of our victims that are involved in 40% of the harm that happens in Alberta. So that means 10% of the victims are involved in almost half the crime as repeat victims of crime, and they have vulnerabilities that lead to them being repeatedly victimized. So we're challenged to start thinking through how do we start to address those? Who can we partner with to address some of those things that to help reduce that vulnerability? So I can talk about offender management. This is a program we've been running in cooperation with the government of Alberta. We've run this program also with Edmonton Police Service and Calgary Police Service. It started, about 10 years ago, and then I'd say about 5 years ago, it took another iteration in becoming the Integrated Offender Management Initiative. Really aimed at addressing the root causes of criminal behavior and leveraging those partnerships with social agencies, health agencies, and us in the criminal justice system working cooperatively to help that offender on a pathway out of that life of crime. With the offenders that have chosen to work in this program, we've seen a 36% reduction in recidivism, and that's consistent. This program I talked about, other programs that we built upon. This started in the UK. Similar results there. I know British Columbia adopted a similar program, similar results there. So, I think the results were expected, but it's really about getting at what are those factors that, drive people to commit crime. And by addressing some of those factors and working with the offenders, really giving them an opportunity to get out of that cycle. We have police and crisis teams here in Alberta, which are mental health nurses partnered with police officers that respond to support calls for people that are in emotional crisis. The teams work collaboratively, and really it's about, assessing the risks and needs of the individual and getting the appropriate services, at the appropriate time. I would say prior to, us having these teams on board, and there's police services right across the country that are running these kinds of initiatives. Typically members would respond to those people in crisis, really not having the appropriate training or education. The tool we had in the toolbox was transporting that person to hospital. With our geography in Alberta, sometimes that transport can be several hours. So you're displacing people from their community. And often, they wouldn't meet the threshold for that apprehension under our Mental Health Act. But they still had the crisis that led to the police involvement. With these teams, the mental health professionals have access not only to their history, so they understand the context maybe of what's happening and the medication that they require, but they can also leverage, maybe community supports and other services that might be able to deliver the services where they need them as a more appropriate service. So we have urban teams in a few of our communities across Alberta, and we're currently at 9 regional teams across the province, which does provide support for all the remainder of the communities, just not on a 24/7 basis, though we are expanding that over the next few years so that we do have that continuous coverage for all the teams. But, it's, I think, been a really good program in terms of the partnership with us and Alberta Health Services and getting the appropriate service where justice isn't the right tool for the job, but maybe that support is needed. I'll talk briefly about a midstream intervention action. So I mentioned earlier we were partnered on the virtual opioid dependency program. So this is a program launched by Alberta Health Services, and they invited us as police services as well as Edmonton and Calgary to participate. This program is available to all Albertans, but really provides same-day start medication for those people that are opioid addicted. That medication provides them protection from overdose death as well as reduces their cravings, which creates a window really to start to get treatment and really help that person in their recovery. So when we take someone into custody that has opioid addictions, or if we're dealing with them through some of our specialized programs, our police officers have access to getting them onto a phone in private with a doctor who can do the assessment and make a determination if the medication is appropriate, and then in fact get them that medication, and either we'll go out and get it for the person that we have in custody or arrange to have it delivered so they can get started. And really, we see that, this maybe improves those health outcomes, decreases their involvement. But, we know that improving those health outcomes and is really going to have the effect of healing our communities, as Dr. Day has said. So, those are some examples of the programming, but, as I think about where does it fit in the spectrum, our offender management program and that virtual opioid are really those interventions where you have people that are already at risk. We're working to try and intervene to, reduce the potential for some of those terrible outcomes. And we are also working with CMNCP in a number of our rural communities here across Alberta on some really upstream preventative measures that hopefully, we often in policing talk about, creating off-ramps out of the justice system so we can get people out. This is blocking the on-ramp so that people aren't getting into the system at all. And I really think there's some, great work happening right across the province that we're doing in partnership with the Alberta Crime Prevention Association, Alberta Reach, and CMNCP to help prevent some of that crime. Lastly, and I think I'm out of time here, but I'll just say, one of the things we're doing is building a data to action for communities. Some of you may have heard me talk about data to action from a law enforcement standpoint. This is building the community and agency component so that we can get a fulsome picture, create a wholesome approach to community safety through collaboration, integrate community and government partners, maximize our effectiveness, and ultimately improve community outcomes and reduce crime and victimization. And I'll stop there.
Thank you so much, Peter. These are truly interesting and exciting directions in policing in Canada, and I think somewhat unique to Canada from what I'm observing. And, I've been partnering with police in my role as somebody responsible for a local crime prevention initiative over many, many years. And I never sort of thought that they would come when I hear terms like, the importance of partnership and collaboration and engagement and root causes, social determinants of health upstream from somebody in a leading role in policing. That's very exciting. Because as we partner, the importance of getting to a shared language and concepts really matters so much. I also appreciated, quite honestly, how right out of the gate, you weren't shy to name some of the challenges right now when it comes to the public's understanding and responses to policing, the calls for defunding, the challenges with institutional racism, which are certainly not something that police alone are facing. Often we sort of say these things behind a closed hand. And you sort of mentioned it right from the beginning. And I've always believed that, as we put these topics on the table collectively, we can really create a change, not in any one organization, but sort of in our communities as well. And much like Santiago, I often say it's not so important who leads, but who leads what and who leads when. You also remind us, much like Santiago, it's also about, how do we lead? And the importance of listening to community and sort of understanding their challenges, but also their resiliencies is something that you point out. So it's exciting, and we'll be watching the further developments of your department or center as time goes on. Thank you, Peter. Last but absolutely not least, our final presentation will focus on gender-based violence. During COVID-19, rates of gender-based violence increased globally, including within Canada. I certainly remember that moment very well. This became known as a shadow pandemic. And while we would like to think that the pandemic, this was a one-time event, realistically, we need to anticipate and prepare for other similar stressful experiences, including such things as climate change hazards. We've asked Karen Campbell to highlight how Canadian communities can work towards shock-proofing against gender-based violence. Karen is the Director of Community Initiatives and Policy at the Canadian Women's Foundation, where her work mainly focuses on ending gender-based violence and building capacity in the women and gender justice sector. Prior to her role at the foundation, Karen worked internationally with community organizations and global networks advocating for the human and labor rights of migrant workers. Karen brings a strong gender justice and intersectional analysis to her work. She sees the potential of feminist philanthropy to serve as a powerful tool for allyship and is committed to making space for communities to participate in decision-makings that affect them. Santiago, I think, set the stage nicely for you in some ways, Karen, by speaking about the importance of women having leadership roles, and we appreciate your leadership role and you being here and look forward to your comments. Thank you, Karen, and the stage is yours.
Thank you. Thank you very much. Good afternoon, everyone. My name is Karen Campbell. My pronouns are she and her. And as introduced, I am Director of Community Initiatives and Policy at the Canadian Women's Foundation. I'm joining you today from London, Ontario, on the traditional territories of the Anishinaabe, Haudenosaunee, Lenape, and Attawandaron peoples, where I am grateful to live, work, and play. The Canadian Women's Foundation is a national leader in the movement for gender equality in Canada. Through funding, research, advocacy, and knowledge sharing, we work to achieve systemic change. Since the pandemic began, we've provided $94 million in emergency pandemic recovery grants to organizations serving women and gender diverse people nationwide. And as I go through my presentation today, I think you'll come to see why that was such a critical investment in our communities. I'm very pleased to be joining you today to speak about what we're seeing in gender-based violence, what we've observed since the pandemic began, and to provide some context about the trends that we're seeing. And I'd like to lay out what we think needs to happen to address these important community safety concerns. So we're now years into this pandemic, and I think sometimes it can be hard to remember what it was like in the very early days when we really didn't know what was coming, or how life-altering this pandemic would prove to be. And I was thinking about that a lot in preparing for this presentation. Um, in the second week of March 2020, when the first lockdown measures were announced, you may recall that was the time when Justin Trudeau was holding daily briefings outside of his residence, and keeping us updated about what was going on. A group of us at the foundation came together and said that we needed to look at the gendered impacts, both of the virus and of the lockdowns, and we needed to start looking at it right away. Even though we thought this might just be a couple of weeks of lockdown, a month at best, we knew that even in that short time period, there would be some pretty consequential impacts on the lives of women and gender diverse people, particularly those lives that are routinely affected by community-wide crisis. So at top of mind for us were First Nations, Métis, and Inuit women and girls who are already facing crisis level rates of violence. They are living in communities with massive infrastructure deficits, some without even safe drinking water, and in communities that are already dealing with addictions and mental health crises, suicide crises, resulting from intergenerational trauma brought on by the ongoing process of colonization. That was already a crisis before this hit. We were concerned about people living on the lowest incomes. So in those early days before CERB was announced, that we were thinking about income losses. And once that income replacement program was announced, we were concerned about those earning less than $5,000 a year who were excluded from that program, or those who were living on informal sector incomes. So thinking about sex workers and other people who earn their money under the table. We were worried about Black, racialized, and immigrant and precarious status women who are disproportionately represented in the jobs on the very front lines of the pandemic. So we're talking about the personal support workers caring for the very old and the very young. We're talking about cashiers, cleaning staff, basically the people who kept our economy running, despite at that time not having vaccines available to them, not always having the supports of their employers to have safe workplaces that would keep them healthy and that would keep their families healthy in this really uncertain time. So all of these things were top of mind, and as the pandemic rolled out, you can see we know that those impacts were pretty acute for all of those populations. And what's more, we were very concerned about the predictable increase in gender-based violence associated with this global health crisis. And as was said in my introduction, this was later named a shadow pandemic by the by UN Women. And so this shadow pandemic looked like GBV crisis lines, shelters, and sexual assault centers seeing huge increases in demands for their services. We saw data from police forces across the country indicating significant increases in domestic violence calls in those early days of the pandemic. There's research now coming out of Western University talking about workplace violence and harassment and how that increased over the course of the pandemic. So it's not just intimate partner violence or domestic violence relationships where the violence is increasing. It's increasing in many different spaces. And we saw that this violence was also increasing in severity, with more cases involving strangulation, stabbing, and firearms. And while these increases in violence were happening in our communities, the community resources to support the targets of that violence were experiencing unprecedented challenges. Not only were these organizations overstretched due to decades of chronic underfunding, leaving them with no surge capacity to respond to this emerging and evolving crisis, but they also needed to move quickly to sort out how to even offer services in this radically altered context. How do you take the services that you offer in person and move them online when your phone line was donated to you in the 1980s and your infrastructure is woefully inadequate? How do you implement crisis text lines? How do you make sure that the people that you're serving even have the equipment or the infrastructure to be able to engage with those mechanisms? How do you meet with people to provide counseling when you really need to in person in a safe way? These are all the things that were happening in the sector, and organizations were really struggling. And remember as well that gender-based violence services are overwhelmingly provided by women whose home lives and caregiving responsibilities were also turned on their heads at this time. And that as important as gender-based violence services are in our communities, the workers that provide these services are among the lowest paid in the nonprofit sector. So this meant that violence rates increased quickly and services were not equipped to provide the supports that were needed. People suffered in silence and people died. Femicide rates in Canada increased by almost 20% in the first 6 months of 2021. So what we see now, about 3 years in, is mass burnout in the gender-based violence sector, an exodus of employees from these services. Women's Shelters Canada is documenting this, and they've called it a feminist brain drain, where recruiting and retaining workers for shelters, for sexual assault services is becoming increasingly difficult. And this is at all levels, from direct service providers all the way up to executive directors. It's a really difficult time for these organizations. So that's a small glimpse of the context of, what's been rolling out over the last few years. The emergence of the shadow pandemic of gender-based violence came as no surprise to us or to anybody working with gender-based violence survivors. Whenever communities are under stress, whether it's from climate-induced disasters like floods or fires, whether it's economic downturns or public health crises, rates of gender-based violence increase. And while it wasn't a surprise to us, it did seem to come as a surprise to a lot of other people. It came as a surprise to the general public, to the media, to policymakers, and perhaps, fairly importantly, to those who were tasked with planning for and enacting emergency response measures. The inattention to the predictable increase of gender-based violence in emergency planning at all levels has had disastrous consequences for women and gender diverse people, particularly those who are further marginalized by race, sexuality, gender expression, disability, immigration status, or location in rural, remote, or northern communities. Almost immediately, we heard from organizations that we fund and work closely with that emergency responses were not taking the needs of their service users into account. So for example, public health messages urged people to avoid COVID-19 by staying home, but they didn't include messaging to indicate that women's shelters and sexual assault centers remained open. And that led many victims to believe that there was nowhere to go, and it compounded the violence that they experienced. Few jurisdictions collected disaggregated data on the impact of COVID-19 on different groups. So it took a pretty long time for public health officials to recognize the extent of the disproportionate impacts on women, girls, and gender diverse people, especially for Black, Indigenous, and racialized people, and for disabled people. So the service providers that we work closely with, they complained that months into the pandemic, when it became increasingly clear that the impacts were not felt equally and that gender-based violence was on the rise, those responsible for emergency responses in their communities began to reach out to them for advice at the moment when they were most stretched and had the least capacity to engage. So as a national foundation that works on these issues, we thought it best to take a look at what we were hearing in the sector and to do some research about, how this was playing out. And so we started working with emergency management professionals and academics to do some research about emergency plans at the provincial and territorial level. And that research has largely confirmed what these service providers were reporting. In an extensive review of emergency planning documents, we found that most federal, provincial, and territorial emergency management and pandemic planning guidance that was developed before COVID-19, that it was gender neutral. At the provincial and territorial levels, only 3 out of 22 plans included any reference to women or gender at all, and attention to gender-based violence was given in only 2 out of 59 planning documents that we reviewed. And I was thinking about this in relation to Ben's comments at the very beginning of this session about whose safety are we most concerned about, who's being left out of the responses. And I think in looking at this, we can see that it's pretty clear. As part of its feminist framing, the current federal government has committed to applying what's called a gender-based plus analysis, or GBA plus, to all of its policies and programs. And we see this approach being applied in international disaster management and relief operations that Global Affairs Canada oversees as part of Canada's feminist foreign policy. However, while the federal government provides guidance to provinces and territories, and I guess by proxy to municipalities as well, on how to apply a GBA plus to their risk assessment and emergency planning procedures, this is not a federally imposed requirement, and a lot of disaster planning and emergency management happens at the local or maybe regional levels. So as such, looking at this review that we did, we couldn't find any evidence that a gender-based plus analysis had been used in the development of any of the provincial or territorial planning processes at all. And we'll be publishing some research snapshots about this before the end of 2022 that we can make sure that we circulate to this group as well. It's our view at Canadian Women's Foundation, and I think probably broadly within the women's and gender justice sector, that violence against women and gender diverse people as an outcome of community stress is neither acceptable nor inevitable. And that's what led to our shockproofing communities against gender-based violence work. Essentially, we're acknowledging that we're living in a crisis era. So if you think about the ongoing pandemic, the climate crisis, various political crises, economic crises that we're experiencing, we know that we can't always foresee or prevent the crisis from occurring, but we're looking at how to shockproof communities against the predictable spikes in gender-based violence during these times of crisis that we can see. And we think that we need to get to that by addressing violence in quote unquote normal times and having the infrastructure in place to make sure that people have support in times of community stress. So I have on the screen 4 pieces of work that we're doing under this kind of shockproofing banner. There are others, but I think these are probably the most important for this group. The first is that we're advocating hard right now for a thriving women's and gender justice sector. So we know that under current conditions, women's and gender justice organizations are not thriving. They're stretched and they're struggling. And we also know that these organizations are essential to the safety and well-being of our communities. So we're engaging the sector in a critical conversation about what our vision of a thriving sector is. What would it look like? What would that sector achieve if it were thriving? And then we're advocating mainly with government for shifts in funding models to support that vision. So that's a big piece of it. The next is about violence prevention. And we think that this needs to happen through a culture shift away from violence and towards safety for everyone. Part of our vision of a thriving sector involves making sure that women's and gender justice organizations are not only in response mode, but that they're doing critical work on culture change through things like healthy relationships education, peer support to engage men and boys in critical discussions about toxic masculinity, bystander intervention, and generally, attempting to get the baseline level of violence as low as possible. When stress occurs in communities, we want people to have better tools to deal with it than to act out in violence against those who experience the highest levels of discrimination and are therefore the most marginalized. We also need to work at the systemic level to make sure that our public safety responses and interventions are not further entrenching in inequalities in our communities by leaving people behind or not addressing their needs. Perhaps most relevant for this group in terms of responding to community stresses, with a view to preventing or mitigating spikes in gender-based violence, we're advocating for emergency responses at all levels to include an intersectional gender analysis. This means making sure that those who face the most discrimination in our society and are thus most likely to experience the most harmful impacts of a community crisis or an emergency are at the center of hazard and risk assessments and emergency plans. Women and gender diverse people who experience multiple and intersecting forms of discrimination should be top of mind in those risk assessment and planning processes. People with lived experience and the service providers who support them should be at these planning tables from the start. And I think maybe looking at how this happens in international disaster relief operations could be a good start to figuring out how to do this well. And the last piece that we're doing is we're building service continuity capacity in the women's and gender justice sector. We know that in emergency responses, there are different kinds of actors that get sort of mobilized to respond. You have your government actors, so any state agencies that are involved in the response. Then you have those sort of auxiliary organizations like your Red Crosses. You have community-based organizations like those that are represented within the women's sector. And then you have sort of emergent responses like neighborhood groups that sort of coalesce to support one another, that kind of thing. And women's organizations are really crucial to that third group, even if they're not always recognized for the role that they're playing. So women's organizations that we have spoken with, not just in the context of the pandemic, but in the context of other disasters. So thinking about wildfires out west, the flooding that happened in Alberta, all different kinds of community stressors. We know that what happens is that they pivot their work away from the regular operations of providing trauma counseling, safety planning, those pieces, and they pivot towards meeting the immediate needs in the community. So maybe it's facilitating transportation for evacuations or providing food hampers in the community. And that's in the case that they can stay open in the context of whatever is occurring that's causing the community stress. And, you know, especially in cases of those serving gender-based violence survivors, this can mean really significant interruptions to the safety planning and healing journeys of the people that they support. So we're looking now at how to build the capacity of organizations to develop and implement service continuity plans. We're doing this alongside professionals in the emergency management field to develop guidance for these organizations on how, in the face of an emergency or a disaster, to continue to provide the services that they need to provide, while as much as possible maintaining fidelity to their core mission and mandate as those on the front lines of supporting survivors. So those are some of the pieces that we think are needed to shock-proof communities against gender-based violence. Again, we know that we can't always shock-proof against the actual stressor that is coming our way, but we do know that it isn't inevitable and it isn't acceptable that gender-based violence should increase during these times. So that's what we're looking at the foundation. We've done a lot of other research on this. We have other components of the project. If you're interested, you can look at our website, canadianwomen.org/SPC, and certainly happy to take your questions today. Thank you.
Wow, thank you so much, Karen. A lot of information in, of course, a very brief time. That's true of all of our presenters, but you've done something that is very rarely done. You have sort of taken a moment of collective crisis for all of us and peeled back the onion layers around what that actually meant for women, for people that work with and for women and those around them. And you've done it with a view to shock-proofing, as we call it, the future, to see how we might not sort of have such staggering increases as, 20% increases in femicide as we did at the beginning of 2021. I remember that precise moment when I sat in a committee meeting, and for all of us, suddenly this light bulb went on when the government was suggesting stay at home, don't go out. In some governments in other countries, there were actual lockdowns, Italy, Germany, and so on and so forth. And some of us then suddenly realized we have just locked women up and children, because it's very much still a gendered issue, with the people that are most likely to harm them in an incredibly stressful time without community and other resources. And we're ill prepared for this very moment. And what you sort of done is you have looked at that moment and you start to prepare us for when that moment will arrive again, as it will likely to. I think it was also an important reminder from you that there are, women, predominantly women working in that industry. And, you talked about mass burnout, mass exodus, a term I'd never heard, feminist brain drain. And how do we sort of deal with that situation? It's less well reported for sure than data of this nature when it comes to the health sector, where we've also heard this as a result of the pandemic. And, that's an important reminder. And then finally, you sort of make me think that evidence isn't just evidence. Evidence is as it's sort of conceived of and constructed by people in power. And I remember the challenges with getting local and other institutions to look at this aggregate data when it came to COVID-19. And it showed some stark inequities, which is why I've always preferred the term building back fairer rather than building back better. So thank you so much for that. I wanted to remind folks also that in addition to the research and reports that Karen has shared, the CMNCP also during that time released a report called Peaceful Homes, a guidance to the prevention of violence in the home during and after lockdown. And there is a practitioner guide that goes along with that. Felix will put it in the chat for us so that you can avail yourself to that resource. And we are at 1 minute to the end of our time together. I could most certainly talk with you all for the rest of the afternoon. I texted Felix and said what an interesting combination of a lineup. And yet, it didn't sort of feel to me like we were at odds here. It feels like we're talking about some of the very same things, the importance of looking to the evidence. Irvin always reminds us of that, the importance of listening and engaging community, not giving up and thinking to the future, and pointing out to some of the underlying societal challenges, such as toxic masculinity and their impact on human behavior. So it's amazing that, three awesome people doing great work in very different areas, not only of the world, but also professionally, come up with such consistent messages. Thank you all so much on behalf of the Canadian Municipal Network on Crime Prevention and all of the conference participants for your time, sharing your wisdom, your insights, and your experiences, and telling your stories. Santiago Uribe, Peter Tewfik, and Karen Campbell, it's been a pleasure having you here. We hope you hang around for the rest of the conference, and I sure hope that our pass again sometime soon. Thank you so much, and we'll hope to see you soon. All right, so this brings us to that time when we are close to the end of our conference in the National Conference of the Canadian Municipal Network on Crime Prevention. I need to say the title again because I just love it. Lean in, addressing social challenges to improve community safety. And we just heard about some emerging trends that can assist us in doing that work. Please do stick around. I know that sort of the topic matter time may be over, but we still have some things to learn. We have a final address from Colleen Cornock, some closing remarks, of course, from the co-chair of the Canadian Municipal Network on Crime Prevention, Jen Fox. And we also have some comments from Mayor Sandra Masters from the city of Regina. So I really do hope you hang around for that. I'd now like to give a really warm welcome to Colleen Cornock. She's the Community Safety Services Manager for the city of Kelowna, and she is a board member of CMNCP, and she was a member of the conference committee for this year's national conference. I had the pleasure of working with Colleen when the city of Kelowna developed their community safety plan. And I can tell you that she is extremely dedicated to her community and to public safety and to good community process. She's also been known to bring chickens to Zoom meetings. And true story, I'm not joking. It's lovely to see you, Colleen, and look very much forward to hearing what you have to say.
Good afternoon, everyone. Wow, it's so hard to believe that we're at the end of our 3-day conference. The time simply flew by for all of us. It's truly been my pleasure to be part of this year's conference planning committee. I'm relatively new to the CMNCP board, and what a tremendous opportunity to connect and collaborate with colleagues from across the country. At this time, I'd really like to acknowledge everyone whose hard work and dedication made this year's conference possible. Pulling together a national conference is a significant task at the best of times. And when you add to it the complexities of connecting via a virtual platform, well, I'm sure you can all appreciate that that was no easy endeavor. There are many folks that I'd like to acknowledge at this time, for without them, this year's conference simply would not have been possible. First, a special thank you to Oishi Furukazaman from the Canadian Municipal Network on Crime Prevention. Oishi, the conference committee and CMNCP staff cannot express how much we truly appreciate your efforts with this event. We created a vision for the conference, which would not have been implemented without your tremendous hard work. As well, thank you to Andrea behind the scenes, Andrea Tubbs from Swansea Communications, for the technical conference support throughout our event. And finally, thank you, Christiane, for your work as our MC. Your engagement, your tremendous knowledge in this area, for keeping us on task. It's an honor and a pleasure, as always, to work with you. We'd like to further acknowledge the following individuals for their contributions to this year's planning committee, including Wendy Stone, Elizabeth Miller, Jan Fox and Dave Dixon, Bonnie Hallman, Audrey Monette, Katie Cook, and Felix Munger. As always, we're already looking ahead to next year's conference, and we encourage everyone to think about in being involved in next year's conference planning committee. If you're interested in taking part, it's a fun group, and just simply reach out to CMNCP staff to find out more. And with that, I'll turn it over to Jan for next comments.
Thanks, Colleen. Good to see you again. I really can't wait to hear the chicken story. Seems like it's a guarded secret, but I'm going to get to the bottom of it. So thanks, everyone, for being here. Like everyone else, I can't believe this conference is already over, and I just can't believe how each year they just get better and better. So that's a huge compliment, Felix, to you and your team. Oishi, you're just amazing to work with. I want to echo that. And I can't imagine a better MC for all of this than you, my friend Christiane. You did a remarkable job. I watched you just do such a professional and incredible job, and just were so engaged. So thank you from the bottom of my heart for doing that for us. So this year's conference themes have emerged in response to many growing concerns among communities throughout the country around social challenges such as substance abuse, sex work, homelessness, mental health. Our goal was to increase understanding and identify effective and innovative approaches to address these issues, since they have the potential to negatively impact individuals, neighborhoods, and of course, communities. I just have so many takeaways from this conference. Christiane did an awesome job of explaining that too, but today's panel was just top notch, so wonderful. The results, Santiago, just the numbers you gave around the reduction of homicides, just unbelievable. And I'm going to be in touch with you just to learn even more about that. So thank you for that. Peter, it's always a pleasure to hear from you. I hope you're still on, and it's been my great honor to work with you on the Rural Crime Prevention Project, with a special emphasis on the data to action. Just was also very, very lucky to be a part of the unveiling of the new community safety and well-being plan here in Alberta, which Peter was really single-handedly responsible for. So grateful for that. And Karen, I guess we haven't met before, but I definitely will be reaching out to you again. I just loved your take on all things gender related, and so many ideas and concepts that I hadn't thought of before. I think I also just wanted to comment on the first presentation I heard, the amazing presentation from the Netherlands and the work that they've done. And to echo Christiane, I think it's just so interesting to understand that throughout all over the world, we're all facing the same challenges, but we're also looking at things in the same way. So we just must be on the right track. I loved participating in the panel that I did. Colleen, thank you again for that. It was a really excellent panel. And then I was privileged to be one of the coaches in a coaching session yesterday. And although we were a small group, I just really appreciated that time to take a deeper dive into some of those issues that we're all facing together. And as has been said over and over again, at this conference, we're all in this together, and there are just so many benefits of learning from one another. So for those of you who aren't already members of the Canadian Municipal Network on Crime Prevention, I sure hope that you will consider joining. I think you will see the many benefits of membership. Okay, please also join me in thanking all of those contributing to organizing and implementing the conference. The team worked tirelessly. My name went up there, but I had absolutely nothing to do with it except to say great job, team. And so I totally appreciate everything that you did. The fantastic presentations throughout the 3 days helped us to achieve the goal that we set by facilitating knowledge, important conversations, and shedding light on the experience and work of people from communities across Canada. So now I'm going to ask that another slide be brought up just to have a special thank you to our amazing speakers throughout the conference and our keynotes and our closing panel. Wap Divard, Santiago, who you've just seen, Peter Tewfik, and Karen Campbell. Thank you guys so very much. And then we had a number of volunteers without whom we wouldn't have been able to do this. And you can see their names up there. Thank you to the session moderators, Travis Lupik, Chris Cowie, Jordan Babando, Asif Sarang, Francis Shaver, Jamie Livingston, Greg Burnett. And of course, special thanks to our own Canadian Municipal Network people, Elizabeth Miller, who has been on it. Every time I've been on, she's been here. And so I know she's worked tirelessly on the organizing, and she's just does so much amazing work in Saskatoon. And to my friend, Leanne Chevrette, also a co-board member from Thunder Bay. Thank you again for everything that you all did. Now you can see, I'd like to just quickly move. I know that people want to get on with their days. It's not too bad here in Alberta, but I know it's a lot later for those of you in the East and wherever else you're joining from. So I wanted to thank everyone for the coaching sessions. As I mentioned, I found mine just so inspiring. And although I was asked to coach, I felt very much like I learned more than I contributed. So thanks to the others who did that. Of course, our own and wonderful Audrey Monette. Chad Nilsson, I didn't know that Chad had participated. If you're on, Chad, nice to hear from you. Chris, you did one too. You were busy this week. Felix, Hillary Demina, Jean Boda, Katie Cook, Kelly Cusack, and Steve Woolrich. And not last but not least, to Neil Thompson. Thanks, every one of you, for doing that. So on a separate note, I want you, this is sort of a drum roll moment where I want you to please don't be surprised if you start to see communications coming from a different entity starting in January of 2023, because we are going to change our name from the Canadian Municipal Network on Crime Prevention. At the 2022 annual general meeting, a motion was passed to change our name to the Canadian Centre for Safer Communities. Canadian Centre for Safer Communities. I love that. This new name emerged after a very lengthy discussion during our board strategic planning session, and we feel that it so much better reflects the work we do and the communities we serve. It's going to be really hard not to say CMNCP anymore, but remember Canadian Centre for Safe Communities. So as Colleen mentioned, planning for CMNCP23 is underway already. And fingers crossed, and if all goes well, the 2023 annual conference will take place in Regina, Saskatchewan in the fall of 2023. With that in mind, it's my distinct pleasure to welcome the Mayor of Regina for some closing remarks. Mayor Masters made history by becoming the first woman elected mayor in Regina. Congratulations. Mayor Masters grew up in the prairies and has called Regina home for more than 23 years. She is focused on efficient and effective city operations, fostering an environment for economic growth, supporting a safe community, and creating fair opportunities. Mayor Masters was instrumental in supporting the creation of Regina's Community Safety and Wellbeing Plan. Welcome, and I'll invite you to the stage, Mayor.
Thank you so much, Jan. I appreciate it greatly. Good afternoon, everyone. I just want to acknowledge first off that I'm coming to you from beautiful Treaty 4 territory here in southern Saskatchewan, home to the Cree, Saulteaux, Dakota, Lakota, Nakota, and home of the Métis Nation. I'll just start off by just giving a shout out to everyone who attended the conference, for participating in anything that's looking to make our community safer. Makes us all stronger, because I know we learn so much from each other and then are able to lift and shift those ideas in other communities. I know that's been our experience here in Regina. Even learning about the importance of collaborating to tackle these social challenges we're all experiencing in all of our communities of all sizes. We're a mid-sized city in the country, but I know in collaboration with this other city mayors within the province, as small as 5,000 in population, everyone's experiencing these things. And even though we have unique challenges facing our own communities, we're all working towards that idea of increased community safety, well-being, and frankly, belonging. It's an honor to be here as part of the closing remarks. I will just say thank you to the Canadian Municipal Network on Crime Prevention, to Felix and his team. We're so grateful to the work that you did here in our city and the support you provided us in developing our own CSWB plan. In terms of that, we approved it in last December, December of 2021, after going through the process pretty much hand in hand with Felix and his team, and what came out of it was validated very much by our community as well as our council, and the feedback so far from communities, they're incredibly hopeful for it. Given that sometimes the wheels of process move slow, we looked at our 6 priority areas that had been highlighted in our plan: food insecurity, substance use, domestic and intimate partner violence, racism and discrimination, safety, and coordinated access to services. Those were our 6 areas of focus, and really appreciated kind of narrowing in on those. We, over the past year, have hosted community summits for all of those individuals involved, individuals and organizations in the community involved in delivering services that hit those needs. In addition, inviting our provincial partners to the table, and we've had everyone show up. It's been unbelievable in terms of coming into rooms and really talking through some kind of where the areas of focus, and validating a little bit that everyone's on the same page, those areas. And it's part of the intent of that was so we didn't lose momentum coming out of approving it. We also invited our good friends at Data for Good, who have a passion for this, the idea of socializing the idea of data with the groups in these particular areas of scope, so that we can socialize data with community-based organizations, but also really start to strive for what type of data do we want to start to collect. I think that's narrowing it in on that coordinated access to services, but allowing on a one-on-one basis for those organizations and for provincial government input into priority objectives and what key results we're looking for. And, it's interesting, out of almost all of them, it was collaboration and streamlining and capacity building were key themes. We created community action tables out of those. That was part of the recommendation. And so we have these action tables, keyword action. The co-hosts that I invited to the summits became co-chairs of the CATs and recruited individuals based on competencies needed to drive actions for the plan and the summit. Provided us recommendations for the action they'd like to advance and the resources they need. All of this work is going to be transferred to our newly created municipal corporation. And so that was the avenue we took. It was one of the models that CMNCP had recommended, and the one we took to push this work outside as an independent municipally owned corporation Community and Social Impact Regina established this fall. They're in the process of hiring an executive director. Please go to regina.ca if you feel like applying here in the city. And all of the work of the community action tables that's been advanced, those priorities and objectives being set, are going to be transferred to the executive director. We just didn't want to lose that momentum and do a little bit of that background work and community buy-in as we went, and provincial buy-in, frankly. That idea of that entity is going to be the connector and the convener, and collecting the data to drive the outcomes and make decisions, organizing the plans that we need for our cities, and the strategies. You know, we know about the competition amongst CBOs and limited funding that's available. And so really looking to make changes within the system to deliver better results for individuals within our community, making sure that everyone has that opportunity to thrive. We've learned so much through the process. No clear blueprint. And I think it's Senator Ted Kennedy that used to say, don't make perfect, be the enemy of the good. And it's a little bit of a trial by error, but we keep pushing forward. We're proud of our city for taking the risk and trying to do something different to achieve these better outcomes, to make this progress. I just don't know how we don't do it without everyone showing up. And we know that a specific organization can't do it alone. But what I've seen and what my experience has been over the last year in terms of moving forward with the CMNCP plan has been that when we show up and we look to collaborate and convene and offer solutions, that our partners step in, whether that's community-based organizations, whether that's private enterprise looking to offer philanthropic help, and the provincial government has been excellent to work with, and really helping us achieve some wins even in this first year. I'll say again, I want to thank each of you for attending, who showed up, for listening, for sharing ideas, and your commitment to serving your community. And thank the CMNCP organizers for creating a space for us to discuss the important issues and really to steal ideas from and be inspired by others. I'm incredibly pleased and very honored that the City of Regina will be hosting the 2023 conference. We'd love to have you here in person. That feel of being in person and feeding off each other's energies would be pretty spectacular. Our city is currently working with the CMNCP staff to plan an incredible conference. We look forward to welcoming you and really continuing the dialogue and learning from each other. And I'll be really happy to report the progress that we've made in our journey and kind of some of our lessons learned. Thanks again for all that you do in the communities across Canada, and can't wait to see you in 2023.
Thank you so much, Mayor Masters. You and I have not had the opportunity to meet in person yet. I hope that will change next year. I'm delighted to see that you have stepped up to host next year's national conference. I did have the opportunity to work with, as part of a small team with your staff at the City of Regina, a very dedicated and able group of people, and also had a chance to connect with community leaders that you rightly sort of point out make such a difference in the design and implementation of these plans. And what really sort of stuck out for me are the Indigenous leaders at the Owazu Center that I had an opportunity to work with. I think you have developed an aspirational plan with some very, very tough and important topics to tackle, and we very much look forward to hearing about your progress in 2023. Thank you also for your continued leadership. The leadership of elected officials is so important in continuing to animate community to do their part. So really appreciate you being here and bringing some closing comments. So now it's my task to officially close this year's national conference of the Canadian Municipal Centre for Crime Prevention, soon to be the Canadian Centre for Safer Communities, CCSC. That too has a ring to it. It's going to take me a while, but I'm sure we'll all get there. As I was thinking about our time together today, and I don't know about you, but after face-to-face events, when people have left, and now it's time, you stack the chairs, you find a home for the leftover food, you recycle the agendas, I'm always sort of left with a sense of both relief and sadness. Relief because events of this nature are so hard to pull together, and I believe that staff and board should be incredibly proud of yourself for what you've accomplished over the last 3 days. again, my hats off to you, Jen, and your board members. When I stopped being the co-chair and you became the co-chair, you gave me this beautiful scarf. So I thought I wear it today to remind you of that moment. And I am just so amazed at what you and the board have been able to continue doing in this sort of tireless mission of creating a municipal voice for crime prevention in Canada. And I know what it takes. It's not that long ago that I worked in this capacity to pull these events together. So special thanks to Oishi. I understand that you did most of the heavy lifting on this, but also Audrey, Bonnie, Katie, Vibia, and of course, Felix. You made us feel welcome. You made us feel supported. You made us look good. And we really appreciate it. And you deserve that relief and that time out after an event such as this that takes so much energy to put together. So I really wanted to publicly acknowledge that and thank you for that. But also to you, Andrea, for keeping us connected flawlessly. Amazing. I think Hopin is my new favorite virtual platform. Also, I hope that in time we have to meet way less virtually and far more in person. So I'm sure you're all relieved and well deserving of a break. The sense of sadness, of course, comes that there's always sort of something still hangs in the air of our time together, from having had a chance to step back from busy lives, take a moment to pause and to reflect and to connect. And that's a really hard space to leave because it's such a great space to be in. I hope that collectively we have ignited our passion for prevention and fanned the flames of our already existing commitments to a world that is more just and that is more safe and sort of gives everybody the best chance to lead a good life. I hope you made new and lasting connections, and I hope you rekindled existing ones. Above all, I hope you remain part of this larger community that we have now formed. If you're not already, and I know Jen already put a plug in for this, but if you're not already a member of the network, please consider becoming one. And when you return to your various corners of this very large country, I hope you know you do so knowing that your work matters, that you matter, and that at the end of my main takeaway from our time together is this: the social challenges may be formidable and at times seemingly overwhelming, but when you bring people together who want to be on the right side of history, everything becomes possible. I have a favorite Dr. Seuss quote. It goes something like this: unless someone like you cares a whole awful lot, nothing will change. It will not. And by your mere presence today, you show that you care. And that is a very strong match in my mind for any social challenge that we could ever face. I hope you enjoyed the conference as much as I did. On behalf of the Canadian Municipal Network for Crime Prevention, wish you a great fall, wish you a great rest of the year. Keep up your good work, and so long for now.